Today I'm going to talk about another case which is basically common and can be seen whether in the UK or any place in the world, especially in certain hotels. So basically the patient will come to you, and after you introduce yourself, as we always agreed, double check the patient name, date of birth. They'll ask the patient, how can I help you today? So the patient might say, doctor, help me. I'm in too much distress. I'm having those itchy bumps which just shown up all of the sudden, and waked up with those itchy, very painful and itchy bumps all over my skin, my face, arms, legs, neck. And I don't know from where they come. I just perfectly slept okay and waked up as such, and I'm really in too much distress from the itching, from the pain, and I don't know what should I do about it. So yeah, I'll ask the patient some relevant questions. How all happened? What do you think the reason for that? If you have any thoughts, what might be the reason? And you will try to explore if the patient had done anything out of the ordinary, all of the sudden, like for instance, visit some places, wear something different, slept somewhere, or went for a holiday. Try to explore and ask if any member of the patient had the same issue, and if they have done anything so far to alleviate basically this itching. And then when you have a picture in your head what might be the issue, in this condition you'll just try to probe certain questions in order to find out, and then examine the patient and treat. So you'll ask if there is any past medical history at all, if there is, as I say, any other family member had the same issue, if the patient has any history of skin allergy or drug allergy or medication allergy, if the patient ate anything at all that doesn't seem the normal thing for them, and if they notice anything that just evolved after them. And you will ask, of course, if the patient is in a shared accommodation, maybe, or visited friends, slept in a different place. And you will ask about furniture, if it's brand new, or if it's second-hand, if so, from where, if it's clean or not, stuff like that. And you will ask what's the condition of the house where they live. And then you will examine. So the patient basically will have like itchy, small, raised skin bumps, which could be distributed in the face, neck, arm and legs, and it could be in clusters, so it can be in groups. And you will see it's basically red spots, maybe excoriated from the scratching. Maybe it's nodular. I once myself, I just cleaned a certain bush, and I wasn't realizing the area is full of insects, and then all of a sudden I just felt like itching and too much pain in my legs. And when I looked down, I was instantly swollen in my legs, too many multiple nodules. They're really painful, very itchy, and itchy beyond imagination. It's just gonna drive you crazy. So I just treated myself and just took a week, and I was okay. So basically, you will try to explore to find out what's the thing, and once you have a clear picture, so you will say it's basically, I think this is insect bite, or bedbugs, or papillary urticaria. So you will ask the patient if he had noticed anything in the bedding, for instance, in the wall, if there is wallpaper in the house, if it's all loose, could be in the back. Sometimes you can't see them with the naked eye because they are very minute, small, dark yellowish, or could be brown or red, tiny thing that can be moving. Probably like 5 millimeter, 7 millimeter, something like that. Ask the patient if he had any tiny brownish spots in the bedding on the mattress, which could be the excreta of the insect. And usually such insects can be hidden in the bedding, in the old clothing, and the bed mattress, and old abandoned furniture, and anything like that. I recall once a lady came to me and she kept saying that having those itchy bumps and I don't know where they come from. I keep cleaning, the house is clean, and there is nothing can be related in one way or another. I just told her, have you looked under your bed? Have you moved your mattress? And when she did so, she told me, yes, doctor, you are right. I find some insects and bugs that I can see under my mattress. Once just she get rid of the mattress and get the treatment, all things has been sorted, and she was content and happy. So in this condition, after, as I say, taking the proper history, you will agree with the patient the plan moving forward. So in this condition, you will ask the patient if they have any concern or worrying at all, and explain to them it's usually clearing itself in a week or so. Just apply cooling cream and to wear damp, clean clothing just to ease the itching and the swelling. And try to keep the area clean, avoid scratching whatsoever in order to avoid and minimize infection. And usually in those conditions, the patient can seek the pharmacist nearby. They can prescribe the steroid cream like hydrocortisone 1%, and also antihistamine pills, 10 milligram once per day, or SOS, like cetirizine, fixohindine. I mean, there's a lot of antihistamine the patient can take from the pharmacy, which will help with the itching. And if the patient is insomniac, because it's intolerable, to be honest. I had it once, and it was really a distressing situation. And also ask them and safety net the patient, tell them if the condition worsen or if the swelling is increasing or it's spreading and it's not improving, come back immediately, and we will take it from there. And also give some advice and measures or tips to get rid from the bed mattress. So if the patient in a habit of, for instance, buying second-hand furniture, ask them, they need to clean thoroughly and carefully the blinds or the tools before getting it in the home. Also avoid any too much clutter around your bedding or in the home, generally speaking, because this can harbor different sorts of insects. Ask them to clean thoroughly and vacuum regularly in order to move and remove anything that might stay in a stagnant area. And also tell them to contact their local council, the pest control services, in order to deal with the situation. And if there is a focus, they can clean it and clear it. Also tell them to get rid of the bedding or wash thoroughly with hot water, at least 60 centigrade temperature, in order to kill the insect and get rid of it. Or if it's too much clothing and there's difficulty or there's issue with the washing, sometimes, like in the UK, for instance, in certain times it's really dull and gloomy and it's raining, so it's impossible to wash and put the things in the sun. So they could put them all in just a plastic bag and put it in the freezer for 3 to 5 days in order to freeze the insect and get rid of it. So that's basically, in short, about bed bugs or insect bite, which can be common and seen in the UK and in certain hotels if the measures is not that optimal as it should be and as expected. And always safety net the patient before leaving the patient to go with the treatment. I hope I covered every single aspect with this condition, and it's common and it can show up in a lab 2 examination. And I see you in another podcast. Thank you.